For 50 years, St. Luke's Cataract and Laser Institute have provided services for residents here in the Tampa Bay area. And today, Dr. Pitt Gills is back with details and some options they are providing. Good to see you. Welcome back.
Well, thanks for having me back.
Yeah, so congratulations on kind of the success of you and your team. How many locations again? Remind everybody here in the Bay Area.
So my dad started in 1968. Obviously, we have one location. Today we have 6. And the primary surgical center is in Tarpon Springs, and then we have a surgery center up in the Villages, and then an office in Spring Hill, Tampa, St. Pete, and Clearwater as well. Yeah.
What we're talking about this morning, which I think is so important, I think it's interesting too with kind of how technology has grown. Certainly this business, what you were in, probably I'd imagine the changes that you guys and your team has seen over the years, pretty phenomenal, right?
Yes, nothing stays the same in ophthalmology, and our team has been at the forefront all along, and they are constantly pushing technology and innovation, with the patient experience being really at the forefront of everything.
Yeah, that no matter where we are in technology, I think that constantly has to be the primary concern. But talk about cataract surgery. I know this is extremely popular. A lot of people having this done. Talk about maybe some of the advancements. I know you wanted to mention lenses in particular when it comes to that particular surgery as well. A lot of improvements there.
Of course. So your natural lens that we're all born with is basically there's cells replicating inside a capsule, and they keep replicating. The lens gets more dense. So in our 40s, we lose that ability to look up close, which is completely normal. And it continues to get more dense. In our 50s, we might get a little more nighttime glare. And then eventually, if we have enough birthdays, we have a cataract.
Okay.
It's not such a bad thing, because when we take the cataract out, we're going to put a lens in that's not only clear, but it's going to be the right power for that particular person. So some people have astigmatism, some people want to be focused for distance, some people want monovision, they've done with their contacts, one distance, one near. Some want a lens that gives both eyes distance and both near. Those are the premium lenses. So we have all these choices nowadays. We didn't always have those. And the quality of those lenses has been improving every year as well. So that's definitely exciting to be able to offer our patients a better result than previously. Well,
because no two patients, I'd imagine their vision is the same. Everybody's going to have different needs. I mean, it just makes sense, and it's got to be an exciting time to be in this business where there are so many options.
You're absolutely right. No patient is the same, and also their lifestyle is not the same. So a big part of it is listening to the patient, figuring out what makes them happy, what their priorities are. You know, are they a pilot? Are they someone who is a commercial driver at night, or are they someone who absolutely despises the idea of having a pair of cheaters on their head? So all those things go into the workup, along with a lot of new technologies that tell us what's going to be best for each individual.
And I'd imagine here in Florida that the population here, we are an active population, certainly as we age as well. I mean, do you see that a lot?
Absolutely. And this right now, the baby boomers are basically at that cataract age, and they do not want to get older. And they want to get younger.
They don't want to slow down.
Yeah, so fortunately, the technology's come along just in the nick of time.
Yeah. Well, and talk about your team too, speaking of being in Florida. From what I understand, you guys are actually doing more surgeries in this state maybe than some of your other counterparts, right?
For decades, our facility, our team has been responsible for more cataract surgeries than any other facility in the state. So that gives us a lot of experience. So we can use that and apply it to our patients. Because it's not always the newest technology or the most expensive lens is the best one. And so we apply what we've learned over time to really match the lens with each individual.
Well, as we kind of wrap up here, what is your take home for people watching today? And obviously there's going to be some choices too on where they go and how they make decisions about their eye care. What do you want people to understand about you and your team, Doctor?
Basically, our team is, 1, we're experienced. 2, we're all about precision. We have a lot of quality checks, and that you only get that after 5 decades of doing it. And the other thing is, it's a subtle difference. We are looking to serve patients, not necessarily fix them. And so how we approach the patients is going to be a little bit different. But we enjoy what we do. We have a really good team of about 350 staff. And
well, you do. You can tell that this is your passion. Thank you, Doctor, for spending some time with us this morning. We look forward to having you and your team back. And in the meantime, there is the info to find out more, the number, the website to call. And again, we hope to see you soon, Doctor. Thank you.
Thank you.